welcome to Let's Talk About It. Tonight, we'll be talking about dental implants. Dental implants is another procedure for replacing missing teeth that are not your grandmother's dentures nor your aunt's bridge work. And utilizing the latest technology and treatment modalities, I have with me my special guest, Dr. Jean-Pierre, a dental specialist in gum disease, also known as a periodontist. Dr. Pierre completed his undergraduate studies at the University of South Florida. He received his Doctor of Dental Surgery degree from Meharry Medical College, School of Dentistry in 2003, where he was recognized with an award for an outstanding achievement in periodontist. He went on to complete his periodontal specialty training at the University of Tennessee, Memphis in 2006, where he received his Certificate of Specialty in Periodontist and his Master's of Dental Science degree. He was also an associate professor in the Department of Periodontist at Meharry Medical College, and he established the Periodontal Care Center in July of 2006 in Hendersonville, Tennessee. Dr. Jean-Pierre, I want to welcome you to the show this evening.
Thank you, Erica. It's my pleasure to be here.
Now, I know with some other things that I did not mention that I would love for you to tell the audience about, because I know that you are on various boards as it relates to periodontal. Did I say that right? Am I saying that right? You know.
Periodontics.
Periodontics. So
sure.
I know it's other boards
Yes.
that you're on. Can you explain to our audience what that is?
Sure. You know, with any specialty, we are members of, say, American Academy of Periodontology,
Okay.
and also the American Board of Periodontology, and some local society, such as the Tennessee Society of Periodontists and the Southern Academy of Periodontology, and various others. So.
Wow. So
Yes.
you're a member to all of those.
Yes, I am. Yes.
In addition to your education.
That's correct. Yes.
Well, I know with that education and that knowledge that you're going to bring a lot to this discussion as it relates to dental implants. But before we even get started talking about dental implants, I want you to explain to the audience, what is a periodontist?
Well, as a periodontist, I devote my practice to the treatment, prevention, and diagnosis of various forms of periodontal disease, as well as the placement of dental implants.
Okay,
Yes.
so I can kind of read between the lines. You are a specialist in some form of dentistry. Will you tell our audience what that is?
Well, yes, as you know, there are 8 different recognized specialties in dentistry alone. And as far as periodontology, basically we focus on the treatment basically around the tooth, known as, gum disease, which we treat mostly surgical, non-surgical, and laser treatment and various forms of treatment.
Okay, so you are a specialist of the gum, which is perfect for dental implants, since the dental implants goes within the gum, which we'll talk about later. So let me ask you a question.
Sure.
There is a difference between just being a periodontist and a board certified periodontist. What is that difference? And tell me, what is the benefit of being board certified?
Well, as a periodontist, I went to an additional 3 years of training, and from there, the final stage is to become board certified. Okay. And only 1/3 of periodontists do become board certified. It's where you are tested by your peers as far as going through an oral board and a written board to be able to be certified.
Okay, so how does your practice differ from just a regular general dentist?
Well, we focus mainly on the patients who have advanced gum disease, or patients who are missing teeth, or have dentures that are loose that need stabilization. So we treat all forms of, as I mentioned, gum disease, and we do aesthetic treatments like gum grafts and different things. And whatever the patient needs.
Okay, so if I go to my dentist and I have some things that are going on that are a little advanced as it relates to my gums, he's going to send me to someone like you.
That's correct.
That's
yes.
correct. All right. All right. Now, this evening we want to talk about dental implants. And, well, what is a dental implant? Because that's not a term that we hear a whole lot. Well, it's becoming, we hear it more often now than we used to. So can you explain to the audience what is a dental implant?
Sure, I'll be happy to. As you know, many people started having just what we call partial dentures, where they used to take it in and out, which they still do. However, a dental implant is a titanium post. It is placed in the jawbone surgically and allowed to heal. And then once that heals, we place another post on that, which then we place a final crown on it that mimic the tooth that was missing. So basically, a dental implant is a wood replacement structure that's placed in the jawbone.
Okay, and it's surgically placed in there.
That's
and
correct.
I know you're going to tell us the process a little bit later.
Sure.
Well, how long have dental implants been around?
Well, dental implants have been around for about 40 years.
Wow.
It started by Dr. Brennemark. He initially placed dental implants in the jawbone to stabilize dentures.
Okay.
So he was amazed on the process, and from there, it kind of evolved from there.
So are dental implants becoming a standard of care, or is it becoming a more realistic option for patients?
More and more is becoming a standard of care as far as the gold standard for wood replacement.
Okay.
And it is really the way of the future.
Wow, okay. So what are the benefits, since it's becoming the way that we're heading as it relates to replacing missing teeth? What are the benefits of a dental implant?
Well, the benefits really, it looks like a tooth. It's natural, very natural. It can bring someone their smile back. And not only that, say if someone has a denture that moves around, 2 dental implants can be placed to stabilize that denture, where they can enjoy, like corn on the cob or a good steak,
Of course.
And then also it's brings someone say needed a bridge. Instead of having a bridge, now you can have only a single implant to replace that one missing tooth there.
So what has changed over the last 10 years? What has made the process better?
Well, a lot has changed as far as the treatment time, the technique, and also just the way the surface of the implants from where they started. So initially you started what they called subperiosteal implant, where it was just placed on the bone.
Okay.
And then it moved to what they call blade implants, where they just put it in the jawbone, where it just fits in the jawbone.
Okay.
And lately we've gone through endoosseous, where it's just a post that's placed in the jawbone that simulates a tooth, a wood tooth.
So I'm sitting here processing all of these procedures. They've all been surgical.
Yes.
They've all been surgical. So 10 years ago, what was the downtime for this process?
Well, 10 years ago, we used to wait a longer to, as far as we will place an implant and then place it under the gums, stitch the gums, and then allow that to heal for 6 months. Then we come back, uncover that, and then place the post to get the final restoration. Well, nowadays, based on the condition and the situation, we're able to place implants, where it needs to be, and allow it to heal for as little as 2 months.
Okay.
And then we restore that.
So in that healing time of 2 months, I guess I'm trying to visualize what happens. You put a post there and nothing's there to cover the post. So what's there for those?
Well, depending on the case. So
Okay.
really, it's the gum basically covers the implant. Say if it's in the back of the mouth, that's no problem.
Okay.
Now, what we can do is, if it's a front tooth, in front of the tooth, I'm able to place a dental implant to where I can mimic a tooth, what we call a temporary crown, to mold the tissue while it's healing, and just to allow someone just to not all walk around without any teeth. So.
Okay.